Hey everyone, thanks for joining us today for our very first Gluten-Free Lifestyles webinar. I'm Angela Reinhardt, and we have a very special guest with us today, Dr. Timothy Jackson. He's an expert in functional medicine, and by combining his background in integrative health and wellness with the emerging field of epigenetics, he's been able to help clients all around the world to regain their health. He is a featured doctor for the MTHFR support group, which focuses on helping to educate the healthcare community and the public about the role of methylation in both health and disease. Thank you so much for being with us today, Dr. Jackson.
Apologize to your listeners and followers that I wasn't able to make it to Florida for the actual presentation. I was looking forward to it, but hopefully we can have another one at some point.
Definitely. We're planning the next Gluten-Free and Healthy Lifestyles Expo for May of 2017. You were definitely missed though, so we're glad that you're here with us today. Can you tell us a little more about your background and how you got into the field of functional medicine?
Yeah, my undergrad is in chemistry and health science. My doctorate's in physical therapy and rehabilitation. I went to undergrad with the intentions of becoming a traditional MD, and I had the grades and the academic scores to go to medical school. But when I did my shadowing rotations at the medical school, all the doctors told me that I would probably be frustrated for 4 years straight because at that point I was pretty heavy into nutrition and exercise and alternative methods of healing. So I got my doctorate in physical therapy, looking to sort of combine that with nutrition. When I first started out of my doctorate program, I was working with a lot of athletes. One example that I give people that I got out of orthopedic medicine is that people with frozen shoulder, where just minute amounts of shoulder movement causes extreme pain. They usually come 2 to 3 times a week for about 2 to 2.5 months. And I just thought that there had to be a better way, so I started researching, and I enjoyed reading about this kind of stuff anyways. But I found out that subclinical hypothyroidism can lead to frozen shoulder. So really, a lot of the musculoskeletal manifestations and pain that I was seeing were just external manifestations of internal issues. And that's why my mentor, Dr. Alex Vasquez, he's written a book called Integrative Rheumatology. I work with a lot of people, and he does as well. He works with more than I do, with musculoskeletal pain that goes away when you heal their gut or you balance the adrenals and the thyroid. And so I figured out that I could help people more with balancing their internal biochemistry and their physiology than by, manipulating their spine.
Wow, that's so interesting that you can address external physical issues by making adjustments internally, so to speak. It shows that our bodies are really well connected.
Yeah, absolutely. And just to give another quick example, one of the MDs that I did some training with, his business partner, who was also an MD or is an MD, he had chronic back pain, and he tried physical therapy, he tried chiropractic, he tried massage therapy, he tried yoga. Nothing helped. And we ran some labs on him, and his pregnenolone was low. And, pregnenolone is your anti-inflammatory hormone. And once we got his pregnenolone up, guess what? His back pain went away. So that's kind of how I think. To me, people say, oh, you think outside of the box. Well, there is no box. You have to kind of look at the whole person. And sure, outside of it, or if there's a trauma situation, and definitely you have to address those acute symptoms. But outside of that, usually long-term, you can go about it through different methods.
Yeah, it seems like the field of functional medicine is growing. More and more people are seeking the root causes of their health problems rather than choosing to mask their symptoms.
It is. Unfortunately, I see a lot of people go to one seminar and then they put up a sign saying integrative, whatever, or functional medicine, whatever. And then I get the fallout from their clients and patients, and Um, the stuff they're doing is not really integrative. Just so your listeners can appreciate, a lot of this stuff I'm going to share with you really took me about between 12 and 14 years to put together. I keep getting doctors and practitioners asking me to put together a manual or a book, and one day hopefully I can do that. But back then there were no Facebook functional medicine study groups or MTHFR groups or anything like that. So I was going to the library a lot. I would seek out, doctors, acupuncturists, massage therapists, physical therapists, to try and just learn everything I can, and try to come at it with a team approach. I don't think I can work with everything or every syndrome, so I refer clients out all the time. Whatever's in their best interest, I'm going to do, and I think they appreciate that because they realize that I have their best interest at heart. And I think that kind of comes back to you.
Yeah, and it definitely shows that you're passionate about what you do. And I think everyone appreciates someone who has integrity and likes to work with others that are engaged, no matter what industry it is. On the other hand, with the current insurance model, it can feel like a doctor spends about 5 minutes with you, and they're more concerned about getting to their next patient than really listening to your concerns.
That's why people, they ask me why I don't take insurance. And my answer is, it's not that I don't take insurance. Insurance doesn't take me. If they did, they'd save a lot of money. But, that gets into lobbying and political realm and things of that nature. And, Europeans and I'm sure the Asians laugh at us as well. We pay so much per month for insurance for stuff that doesn't even work. And it's kind of like, where's that money going? When I worked at Health South, I had a few patients who, were in their elder years, and they had opted out of just using or having insurance and just saved and invested that money. And it worked out better for them doing that than, just paying insurance.
If you're just now joining us, we're talking with Dr. Jackson. He's given us his background, how he got involved in functional medicine, and given us an idea of the depth of research he's had to do to become an expert in his field. Today, he's going to help us understand the hidden causes of chronic illness. So, Dr. Jackson, could you tell us what types of chronic illnesses you're referring to?
Any type of disorder that involves multiple symptoms or syndromes, so neuroimmune disorders. In this country, we tend to call them autoimmune disorders, but they're really neuroimmune disorders, meaning syndromes that involve both the nervous system and the immune system. I work with a lot of people with Lyme, mold, and they may not know that they have Lyme or mold, or co-infections when they come to me, but that's why we do testing. I'm not like some people where I just want to test everything under the universe. I'll only test something if it's going to change the outcome of what we do. So I deal with everyone from professional athletes to kids on the autism spectrum. I think my oldest client is 79 or 80. My youngest, of course, I deal with her parents or his parents, and they're 2 years old. It kind of runs the gamut of issues that I deal with. It's pretty much stuff that has kind of stumped other doctors. If I had to put a number on it, I'd say the average client I see is seeing, 7 to 10 other doctors. A lot of them, I get some people that have ordered, up to $5,000 to $10,000 worth of lab work, and they'll say, "Oh, my doctor said it's fine." And I said, "Well, let me take a look and, just double check." And it's really not fine. So it's not about, just as an aside, how many labs you can order or you should order, but the information, being good at being able to extract information from the lab results that you're given.
Okay, that makes sense. So, when you're talking about autoimmune, or you called it neuroimmune disorders, are you referring to celiac, diabetes? What are some of the specific conditions that people might recognize?
Alzheimer's, Parkinson's, MS, ALS. And you could stretch it and say cancer, autism and Asperger's, developmental delay, mitochondrial dysfunction, which we'll get into all that and what that means. Those are all diagnoses. And then things like scleroderma, rheumatoid arthritis, Hashimoto's thyroiditis, because your body is really too smart to attack its own self or its own tissues. But pathogens are very smart, pathogens meaning viruses and bacteria and things of that nature. And when they are in our body, or if they become active in our body, they can really manipulate the immune system to their advantage. So we tend to kind of think of them as, lower down on the totem pole, but they actually have a lot of ways of tricking our immune system. Epstein-Barr virus, for example, can cause Hashimoto's thyroiditis, and increase thyroid antibodies. There are other things that can cause it as well, but we really don't have an appreciation in this country. We'll talk about viruses as a whole category, but when I typically say viruses, people think, having the flu or something of that nature. But there's a whole nother realm of how viruses operate out there. If you look at the research through PubMed and things of that nature, you'll see that certain viruses are connected to cancer, autoimmune disorders, neuroimmune disorders, etc. They can cause symptoms that differ in everyone. So if we had, let's say 15 people in a room, in a conference room, and we all had Epstein-Barr virus, we may all manifest symptoms differently. One person may have insomnia. One person may have brain fog. One person may have extreme fatigue. One person may have, autoimmune or neuroimmune issue. So that's where the immunologists kind of forget about things. An important example I'll give you for myself, way back when I started running this stuff, is I tested positive for Coxsackie-B virus. And I believe there's 6 types of Coxsackie-B, and type 4 increases your risk of cardiovascular events by about 33%. Yet how many cardiologists are testing for that? None, even though it's been done in the research. So, the things I'm talking about are backed by research or, significant clinical data collection. And those are the sorts of things that I deal with. I kind of take the same approach with everyone, whether it's a kid with autism or Asperger's or a pro athlete. I have kind of a pyramid or a hierarchy of how I go about addressing things.
I really appreciate that the findings you're sharing with us today are based on up-to-date clinical research. There's so much misinformation out there, so we really have to be careful what advice we follow. You mentioned that these viruses can cause different symptoms depending on the individual. So is there a genetic link to that?
Yes and no. What happens is in utero, you get a passing of viruses from mother to child. And, there's a certain class of viruses that are what we call neurotropic. They get in the nervous system, in the myelin sheath that surrounds our nerves. And it can cause developmental delays, concentration problems, attention problems, things of that nature. And, the blood-brain barrier in children isn't formed until around age 4 to 5. And so, if you and I catch a virus right now, sure, it'll have an effect upon us, but it'll have, 10 times the effect on, a toddler or a newborn. I don't want to get too far into the vaccine debate, but when you add in the adjuvants from certain vaccines, you really need to think about 1 + 1 = 10. The average umbilical cord today has between 250 and 300 known carcinogens. Then we overwhelm their immune system with vaccines. And on top of that, the vaccine adjuvants. And then on top of that, any toxins that were dumped from mother to child. And so children really today are coming out, behind the 8 ball. So you really, I get a lot of women that are, trying to conceive, and they want to conceive like right now, and I ask them, please give me 6 months or 9 months to make you healthier, and it'll make your baby healthier, and everyone will be happier. It's much easier to prevent these things and go about them that way than it is to fix the problem after the fact. So if it's okay with you, I'll kind of start my outline and go through the topics, and then you stop me if there's a question or something doesn't make sense.
That sounds great, and I wanted to let our listeners know, or at least those that are on the live webinar, that if you have a question at any time, you're able to add it to the question area, and Dr. Jackson will either cover it in the Q&A portion, or if possible, he might even weave it into his presentation. So please feel free to comment, ask questions. This presentation is for you. We want to know what you're interested in learning more about.
Yeah, so I have kind of 6 categories that I came up with that you've probably heard about some of them, but maybe in a different context, or some of them you haven't heard about at all. We hear about adrenal fatigue, and we hear about gut issues, but some of these other things that I'm going to talk about kind of are upstream of those problems, meaning that if we fix the issues I'm going to talk about, a lot of times it'll fix the other issues. Not always, but a lot of times. So my first category I wanted to discuss, that, and the main reason being that we can't really see it, is mold. Mold is a huge issue. It means a lot to me both professionally and personally, because I have the gene where I can't detox mycotoxins. And you can have what's called your HLA-DR genotype tested through LabCorp, and that will tell you how good of a detoxifier you are of mold. There's around 200 plus species of mold out there, and people are under the false impression that you have to see mold or smell it in order for it to be present. I have a number of clients with $1 million homes, and they get offended when I suggest mold, but it's not a reflection of your hygiene or your cleaning skills or whatever. So with mold, a lot of people think that older homes are the problem, and certainly they are a contributor to mold issues. But the newer homes can be even more problematic. And after talking with a guy whose family is in the construction business, the way they seal homes today to make them so tight and energy efficient, it creates or leaves just a few species of mold in the home. And when you have just a few species, there's not a lot of competition. So the species that are there, they can kind of grow and manifest without any competition. Versus where outside there's multiple types of mold, and it's safer that way. And then so with mold, certainly black mold like Stachybotrys you can certainly see, but other types of mold like Aspergillus and things of that nature you cannot see. And so let's talk real quick about how you can test your home. The over-the-counter test kits are not accurate. I'll give you the name of the test, and I have no affiliation with the test. It just happens to be the one that one of the mold doctors, the main mold doctors, recommends, and it's called the ERMI, capital E-R-M-I. And another one that's a little bit newer is the HERTSMI, HERTSMI-2. And both of those can be purchased through a website called Myco, M-Y-C-O, metrics.com. Okay, and so both of those will tell you about the levels of mold in your home. Now, you have to interpret it in context, because if you have a genotype where you can't detoxify mold and mycotoxins, then your level needs to be lower than someone who doesn't have that. So, you may get results back and your number may be perfectly within the middle, but if you have a genotype where you have trouble detoxing mold, then you need to have a lower number than someone without that genotype. So those are ways to test your home. Remediation, we could have a whole, program on mold, but remediation in general, I like to use biodegradable enzymes, because if you use potent things like ozone, it can lead to dead mycotoxins being released, which you would think would be good, but dead mycotoxins stimulate your immune system. So that's not such a good idea. As far as testing your body for mold, you can test, there's a lab called Real Time Labs. And again, I have no financial affiliation with them. They just happen to be the only urine mycotoxin testing lab that I know of. And again, you can test your urine mycotoxin levels with one caveat that I've discovered over the years. If you have one of the genotypes where mold is, you have trouble getting rid of it, you may show up low on the urine mycotoxin level test because you're not able to excrete it. So the trick that I use is I have patients go in and get a glutathione push or take a lot of glutathione orally and then collect their urine 30 to 45 minutes later, and usually the numbers will go up. So you can get a false sense of security if you just test and you have one of those genotypes, because you may not be able to excrete it. So we talked about, 200 plus different types of mold, how to test your home, how to test your body, how to test for the genotype. To my knowledge, that genotype can only be tested through LabCorp. And so you can figure out, if you have it. It's not the end of the world. Myself, I have the worst one, the dreaded genotype. Just means you have to be more careful, especially if you live somewhere like in the southeastern United States where it's very humid. Or even in Arizona where I live, some houses have swamp coolers, and they'll leak a little bit of water here and there, and that's all it takes, for the mold to release mycotoxins. And mold and mycotoxins, they really disrupt every system in the body. If you look at MRI scans from people with MS and people with mold toxicity, they look exactly the same. Mold decreases blood flow to the frontal lobe. It can cause permanent brain damage. So, there's a component of mold, I would say probably in every illness almost. So that's kind of the mold spiel. It's very, very common today. There's different protocols I use to get rid of it, natural protocols, and then sometimes I'll refer people to their primary care physician for certain medications to help get rid of the mold. But you don't want to start a mold detox program unless you've remediated your home. And, there are a lot of people out there, mold remediators, that are in it for the money, and they just want to kind of tear down everything. If you want to contact me personally, I can direct you to some people I know that do good work that, don't overcharge and don't do things that are unnecessary. So that's my mold spiel. Any questions so far?
I think you covered it as far as testing our genetics to see how we are able to detox it. Mm-hmm. And then if it's in our home, we need to get that remediated.
Yeah, maybe we can get a 2-for-1 deal, myself and your husband, on. We can talk about, home construction and testing for mold and how that affects things. Like I said, in the southeastern United States where my parents live, you have to take extra precautions. So they have 2 dehumidifiers underneath their house to, decrease the humidity there, before the air goes into the HVAC. Some people will also put a UV light at the beginning. I'm not sure about the efficacy of that. I haven't really seen any research data on it. There's different types of air filters out there, some that get very, very expensive. But one of the things that I wanted to point out is that, mold affects a lot of hormones in your body. Not only your sex hormones, they affect a hormone called alpha MSH, which is a hormone that is anti-inflammatory and helps with sleep. So your sleep quality is disrupted. You have out-of-control inflammation, or what we abbreviate CIRS, chronic inflammatory response syndrome. And so that's kind of the mold issue. And you just have to be more careful. So, 25% of the population has one of these genotypes where they have trouble detoxing mold. The other 75% of the population are looking at us like, wow, these people are crazy. There's no mold in here. And let me say this, I can't be more emphatic about this. Bleach does not kill mold. Trust me. If you research it online, bleach does not kill mold. And so as far as protecting your home, if it's raining, never keep the garage door open because the moisture will come up and go into the room above the garage. Always, do a check for leaks, as often as possible. There's different air filters like the Austin air filter, the Oasis air filter, that filter those mycotoxins out, or at least help. But one thing to consider too is your car. A lot of people, have had water damage to their car, and they don't consider that as a source of mold, but it most definitely can be. And again, it's kind of like EMF. We don't take mold that seriously because we can't really see it unless it's Stachybotrys. But it's something definitely not to play with, and can cause a lot of downstream effects, inflammation, joint pain, thyroid issues, autoimmune issues. And I've been studying mold since 2009 when a medical doctor friend of mine introduced me to it. And it's really something that's overlooked, and I get a lot of clients with it. And it's something to definitely take into consideration. The mycotoxins that are released from mold, they go straight for the mitochondria in your cells. So they affect energy production and tissue function. So that's kind of a summary of things you need to know about mold. If you guys are interested, we could do a whole podcast on mold, get truly detailed, and I'm certainly not an expert in it, but I've been studying it for a number of years for personal and professional reasons.
So once someone recognizes that they have an issue with mold and they remediate their home, they have the testing done, what is the time frame as far as correcting the problem?
The time frame for remediating their house or detoxing their body?
Detoxing their body.
Okay, yeah. So that's going to depend on a number of things. Sometimes when you try to pull mold out of the body, it creates inflammation. So you have to be careful with that. But the protocol I use is called a lipid exchange protocol, or Patricia Cain protocol. And it involves high doses of phosphatidylcholine, oxbile, and lipase, and it flushes out the gallbladder, because that's where these mycotoxins tend to hang out, is in the gallbladder. So that's one way. The other way is if you want to go to the medication route, cholestyramine, which is cholesterol medication, but it binds up mycotoxins in the body. That's one way. There's another medication that's similar but not as potent, and that is Welchol. And then one more natural, holistic way is to use certain binders, zeolite, Takasimi Supreme, activated charcoal. All of those can help But then that, gets into bowel health. You don't want to bind up things and then not be able to excrete them. So that's an issue as well. But as far as a time frame, it's going to vary from person to person, and how well their body is functioning overall, the terrain, hormonal status, things of that nature, as to how long it takes. But you can make a significant impact within 8 weeks of detoxing mold. You just have to make sure you're not still being exposed to it.
Well, that's great to know.
Yeah. So that's kind of my summary of mold. It's something very important not to be overlooked. So if it's okay with you, I'll move on to the second topic that a lot of people know about or heard of, but may not have a lot of information or knowledge about, and that's Lyme. Lyme bacteria, Lyme disease, quote unquote disease. And, Lyme is a spirochetal bacteria similar to syphilis. There's a huge myth out there that it's mostly in New England, and that's just completely false. If we stop and think about how silly it is, pigs don't read road signs, so they don't go to like the state borders and say, oh, we can't go here, so we're going to stay in New England. So it's been found in every state. The species will differ. There's tons of different species. They're in a lot of European countries, and there's a good book. I haven't read all of it, but it's called Lab 257, about how Lyme kind of escaped this lab in Connecticut. I believe it's Connecticut. And with Lyme, first of all, if you want to talk about testing, well, the traditional test done for Lyme is the Western blot test. But that test is wrong 46% of the time, okay? And so it's basically like flipping a coin, because once the bacteria gets inside you, it turns off your immune system, the B-cell immune system, and that's exactly what the Western blot is testing. So you're testing something that your body can't respond to. There are some other functional labs that you can use. They tend to get expensive, and even those have a pretty high rate of false negatives. There is at least one lab that cultures Lyme bacteria, so you can see it under the microscope, so that can be helpful. And then there's energetic testing. It's not muscle testing, but it was developed by Dietrich Klinghardt, MD, PhD, and it's called autonomic response testing. And, it looks kind of hokey from the outside looking in, but if you have it done, you'll be surprised how accurate it is. And then, some people will have confirmed things with blood work, but the ART, autonomic response testing, is another good way to test for it. An interesting aside, to be CDC positive for Lyme in the U.S., you have to have 5 bands that are positive. In China, and I think a few other Asian countries, you only have to have 1. If you haven't watched it, please watch the movie Under Our Skin. I think you can see it for free on YouTube. And actually, the building I used to treat out of is featured in there. In California, West Coast, and even Midwest, you can treat Lyme, and it's okay. But, in the southeastern United States, you have to keep it kind of hush-hush. I had a patient that went to the medical school where I went, and the immunologist said, yeah, you have Lyme, but I'm not going to treat you because I don't want to get in trouble. And so there's definitely a political component to it, which is unfortunate. And that, along with the poor testing reliability, leads to delayed diagnosis. And so it's very prevalent. And a lot of people think that, if you have Lyme, you have trouble walking or joint pain. But again, it manifests differently in everyone. At one clinic I worked at, we had an NFL player with tested positive for Lyme. And his symptom was that, when he got injured on the field, he didn't recover quite as fast as he should have for a 26-year-old. So a lot of people will manifest different symptoms. Me, I probably had it before I treated it for years and years growing up in the country. But, I ate healthy, at least, starting later in my teenage years, exercise, try to get to bed on time. So a lot of people are walking around with it, and it may not be active, or it may take a stressor, something like a car accident or a surgery, to bring it out. And then you get the symptoms that vary from fevers to joint pain to insomnia to nausea to gut. We call it Bell's palsy of the gut, where peristaltic waves in the gut slow down. A lot of people that come to me, they say, "Oh, I've never been bitten by a tick." You really don't know if you've been bitten by a tick, because most ticks are so small you can't even see them. And all they have to do is hop on and hop back off. And that's all it takes for you to get infected. Now, if you see the tick and you detach it correctly, and you go on doxycycline or another antibiotic for 30 days, then there's a good chance of just eradicating it completely. But not probably 95% of the population or more, they don't see the tick. They don't know they've gotten bitten. And the other thing to remember is that it can be transferred by mosquitoes. It can be transferred sexual transmission. So it's no longer correct to refer to it as a tick-borne illness. As far as treatment goes, there are antibiotics, of course, but as a mentor of mine says, you can't kill your way to health. So you have to change the terrain of the body, detoxify, far infrared sauna. I use a combination of high-dose homeopathics along with herbs. Some people will use homeopathics and antibiotics. But if you do that, you really have to find a medical doctor who's well-versed in Lyme, because there's certain combinations that you have to use, or you can make the co-infections, which I'm going to talk about next, more potent. Does that make sense?
Definitely. I've had several friends that have had it, and it's a very complex condition that you need to work with someone that knows what they're doing.
Oh, yeah. I have probably 5 or 6 clients who are MDs, and I think 2 of them have Lyme. And, a lot of the Lyme doctors, granted, they're very busy and they can't cover everything, but you have to cover biofilm, which is the kind of the shield that these bacteria and pathogens use to protect themselves. You have to work on detoxification. You have to work on gut health. You want to balance the immune response. You want to protect yourself from EMFs. You want to check yourself for mold and detoxify that. That's an issue because mold and Lyme tend to go hand in hand. You want to treat it from my perspective, from a homeopathic point of view and from an herbal point of view. But again, some people are on antibiotics for long periods of time, and antibiotics, they're derived from mold and yeast. So a lot of times people don't tolerate them, and they just, eradicate your gut flora. Now, the co-infections that go with Lyme, there's many, but I'll focus on the 2 most common, and those are Bartonella, cat scratch fever, and Bavasia. They can cause similar symptoms to Lyme, so sometimes it's really difficult to tease out and say, oh, this is causing this or this is causing that. You just know that this collection of pathogens is causing a disturbance. And those have a different set of herbs and different homeopathic remedies used to treat them, and as well as different antibiotics if you choose to go that route. Some people call Lyme the co-infection, and they call Bavasia and Bartonella the actual infection because they're so common. While I'm thinking about it, it just crossed my mind is that a lot of people will say, oh, I didn't have a bullseye rash, so I didn't get bitten. Well, depending on who you read and who you talk to and what scientific papers you read, only between 9 and 33% of people who get bitten have a bullseye rash. So you cannot use that as a diagnostic marker for whether you have Lyme or not. As far as the co-infections go with treating, and again, as far as how long to treat, it's going to vary from person to person and what your internal terrain, so to speak, was before you had the Lyme. You have to balance your hormones, your adrenals and thyroid, your gut health, You have to work on methylation and detoxification. Sauna use is good. Detoxifying mold, protecting yourself from EMS. All those things you have to really address. And you want to use binders as well. You want to make sure, obviously, you're going to the bathroom regularly, preferably at least twice a day. And you can use binders like zeolite and activated charcoal and toxemia supreme, etc. So that binds it up, binds the biotoxins up, and helps release the biotoxins. Biotoxins is just a term that refers to mold toxins, Lyme toxins, and toxins from the co-infections. So that's kind of Lyme and co-infections. I mean, again, there are entire books that are written on this topic. A lot of information out there. You want to work with someone. Usually, it's going to require a team. I co-treat with a lot of MDs because they manage the antibiotic part or the killing part, and then I work on hormonal balance, detoxification, methylation, because they just simply don't have the time or the patience to do it. That's Lyme and co-infection. So that's something else that's often overlooked. And if you've had a diagnosis of chronic fatigue syndrome or fibromyalgia, I highly recommend you be tested for Lyme and co-infections. And sometimes I don't even recommend that people get tested. I just go by their symptoms because the tests can get very expensive, $800 up to $1,800 or $1,600. And so a lot of times it's a clinical issue. Since we're not using antibiotics, we're using homeopathics and things, it's a little bit easier on the body. I'm going to skip to another topic, then I'll come back to mitochondrial dysfunction. But while we're talking about infections, I mentioned earlier viruses. So if someone says, I have Lyme, they're not going to just have the Lyme bacteria. Or if someone says, I have this virus, they're not going to just have that virus. Pathogens come in groups. They like to congregate. They're like little gangs. And they're surrounded by the biofilm, which biofilm, if you don't know what it is, the plaque on your teeth is biofilm. Dentists were the first to discover it. But you also have biofilm systemically because the little pathogens, they're a lot smarter than we think, and they create a shield around themselves to hide from the immune system. Behind that shield, they sequester heavy metals. So that makes it extra hard. So if you're treating Lyme or co-infections or viruses and you're not addressing biofilm, you may require higher doses of those nutrients. Conversely, if you add in a biofilm busting agent, you may have to lower the dose of the antimicrobials because otherwise you may Herx too much. And Herxheimer just means die-off type reaction. And one point I wanted to make real quick is that a lot of times people, they say they feel really bad and a lot worse when they start killing things. And that's because they already have a baseline level of inflammation. If you don't get that level of inflammation down and you start killing things, you're just going to create more inflammation. So you want to address the biofilm. Now back to the viruses. Viruses, most of the time, if you have Lyme, you're definitely going to have at least, I'd say, 2 viruses or more. Now viruses, people are going to say, oh, well, they're not technically alive, so you can't kill them. And they're correct, but you can lower your viral load. One misconception, and you'll know more than most integrative doctors in this country, is that if you test your IgM titers and your IgG titers to a certain virus and the IgM is negative, but the IgG is elevated, if it's elevated high enough, it can indicate a current infection. And that's a common mistake I see even among functional medicine doctors. Dr. Jacob Teitelbaum, if you follow him, or my mentor, Dr. Alex Vasquez, he'll tell you the same thing. I treat viruses a couple different ways. 1, homeopathically. 2, antimicrobials, certain nutraceuticals and herbals, and working on methylation. because viruses are technically parasites. They live in our DNA, so they need our cells to replicate in order for them to survive. So just some common viruses that I'll just mention. Epstein-Barr virus we've all heard of, but it can cause a lot more things than, mono. It can cause neurological issues. There's a connection to certain types of cancer. CMV or cytomegalovirus, same thing. A lot of these are connected to those neuroimmune or autoimmune disorders we mentioned before. HHV6, human herpes virus 6, that's another one that can cause fatigue and brain fog and insomnia. And it's technically not the pathogen you're feeling. What it is are the pro-inflammatory cytokines. And trust me, you know what cytokines are, even if you think you don't. When you've had the flu before or cold or just didn't feel well, those are the cytokines that are making you feel poorly. And we have to get those under control. And there's different nutraceuticals you can use. In the long term, obviously, the more we can lower your viral load or your pathogen load as a whole, the better off you'll be. So we talked about Epstein-Barr virus, cytomegalovirus, HHV6, Coxsackie-B virus, I check for sometimes, parvovirus. And then this one isn't a virus, it's a bacteria of sorts, Mycoplasma, you've probably heard of, and it's a cell wall deficient bacteria. The reason that cell wall deficient part is important is because most bacteria have a cell wall, and the way that antibiotics work is they destroy that cell wall. So it makes the mycoplasma a little harder to get. But I'll tell you just a quick anecdote, and again, this isn't happen all the time, but somewhat frequently. I had a client in another state, and he tested very high for mycoplasma, and I gave him a homeopathic remedy for the mycoplasma, and 2 weeks later he's calling me up and emailing me saying he's a different person. A lot of people underestimate mycoplasma, and a lot of these things can manifest as joint pain as well. They've found mycoplasma in the synovial fluid in the knee. So again, that gets back to the musculoskeletal component that these infections can cause. The infections are going to constantly stress your adrenals. So, we talk about adrenal fatigue. Well, your adrenals don't activate themselves. It has to be some sort of inflammatory stressor or a brain reaction that turns on the hypothalamus pituitary adrenal axis. So you can take adaptogens and things like that to support the adrenals, B5, vitamin C, but you want to ultimately long-term work on these other stressors so that the adrenals aren't constantly turned on.
Right. So again, getting to the root of the problem rather than simply addressing the symptoms.
Right. And if your listeners go to my website, there, healyourbody.org, there's a free ebook called Beyond Green Allopathy. And so I just want to take a quick moment and explain what green allopathy is. Green allopathy refers to, say, you go to a naturopath and you're on, say, 14 or 15 medications, and they just kind of replace those 14 or 15 medications with supplements. That's not really getting to the root cause. That's not really much better in my opinion. So integrative and functional medicine is really looking at the root cause. I'm not saying in the short term it's not beneficial to have those supplements. But long term, we want to be a detective, put on our detective hat, and look for these pathogens, gut dysbiosis, Lyme, mold, etc. So I'm going to go ahead and move on to our next topic because it's really important. And it's kind of a hot button topic these days, and that's mitochondrial dysfunction. And so you've probably heard of the mitochondria. They're the battery of our cells, help produce energy. But if we wrote down, like on a dry erase board, pretty much every disorder or syndrome or illness we could think of, and we said, what's a common denominator amongst all of these? It would be mitochondrial dysfunction. Okay, so your mitochondria, when I say they produce energy, yeah, you can think of it as like exercise type energy, but also just regular energy for your tissues to function. So for your liver to detoxify, for your heart to pump blood, your mitochondria have to work. or those organs start to dysfunction. Okay, and we could do a whole webinar on mitochondrial dysfunction. A lot of people, will say, "Oh, you have mitochondrial issues, just take carnitine or CoQ10." But there are many other things you have to do to protect the mitochondria, and a number of different supplements that can help. Going back to the infections, you want to try and calm those down and lower the load of those pathogens, because they can create microbial mitochondriopathy, just meaning that a pathogen is damaging your mitochondria. When you get mitochondrial dysfunction, you get decreased blood flow from the heart, decreased what we call cardiac output, gut health declines, brain health declines, neurological health declines, immune function declines. So a lot of times people are taking things and they're like, "Oh, it's not working, it's not working." Well, it may be that you don't have enough energy, or ATP as we call it, for those tissues or for those remedies to work. That's a very complex topic. My mentor's written a whole book on the mitochondria, but you want to also protect the mitochondria with antioxidants like glutathione and superoxide dismutase. Glutathione is your body's most powerful antioxidant, so you want to make sure that your levels of that are optimal.
And how do we support that?
You can support that a number of ways. There are topical glutathione creams that I use. There are oral liposomal glutathione supplements. If you can get a prescription, you can get a nebulized glutathione. So those are three different ways. Just regular plain oral glutathione doesn't work very well. But the liposomal, as long as you're taking it on an empty stomach, works very well. The transdermal works well. And then you can take some of the precursors. Some people do well with things like N-acetylcysteine. There's a test you can do, I forget which lab it's through, to look at your oxidized glutathione versus reduced glutathione. You want to make sure that you're able to recycle your glutathione from the oxidized form to the reduced form, because that's the form that helps you. Just to give you an idea of the other things that glutathione does is, besides protecting the mitochondria, it helps heal the gut, protect the thyroid, enforce the immune system, protect against viruses, lots and lots of things. It helps detoxify chemicals, heavy metals, helps protect the brain from oxidative stress. I could go on and on. So it's extremely important. And one doctor I know said it's basically impossible for you to develop an autoimmune disorder if your glutathione levels are optimal. And you want to think about it as, okay, well, you may have some genetic glitches where you don't produce enough glutathione, but then, you go outside maybe for a walk. Every car exhaust you're exposed to, that depletes your glutathione. Mental and emotional stress, that depletes your glutathione. Any toxin you're exposed to will deplete glutathione. So you can test, but pretty much everyone can benefit from some glutathione. Again, you just want to make sure you recycle it. And if people want to get in touch with me, I can talk to them about how to do that. That's the mitochondria. Another way to help boost the mitochondria is to get rid of the harmful fats that are in the membrane of the mitochondria and replace them with healthy lipids. There's different products to do that. The other thing that helps is actually grounding or earthing outside or walking on the beach. Anything that adds electrons to your body will help the mitochondria. Okay, because what we've talked about so far is essentially physiology and biochemistry. But the biophysics, the electrons and the protons are really what drive it. And that's why, if you guys are familiar with my friend Jack Kruse, Dr. Kruse, he talks so much about EMFs, magnetism, earthing. We've lost touch with the ground. And, these are things that are free to do that can really impact your health.
Right, especially here in Florida. We have no excuse to not enjoy our beautiful surroundings, although it is quite hot out there right now.
Yeah, and, as far as the vitamin D goes, sure, we get vitamin D from it, but I'm positive there's probably hundreds of things that the sunlight does to us through our skin receptors that we haven't discovered yet. And so I think light is extremely important. And you can read Dr. Cruz's blogs. Are kind of heavy, but you can go through and read those. So that's mitochondrial dysfunction in essence.
Thank you for explaining that, Dr. Jackson, in a way that we can all understand. Before we go on, we have a question from Rachel. She wants to know if you're currently practicing in Florida.
I'm not, but 99% of my practice is virtual. So I have clients in all 50 states, Hong Kong, Thailand, UK, Sweden, Scotland. So I do, virtual consults, Skype, WebEx, and work with clients from all over the world. I'll give my email at the end if she wants to contact me. I have a special gift for the listeners at the end as well. The last topic I wanted to touch on is jaw cavitations. And that just means a cavitation is just a pocket of dead bone, of infection. Now, I'll just go ahead and warn you, if you try to talk to your traditional dentist about this, he's going to say it doesn't exist. But it certainly exists because there are machines that measure it, and I have friends that have had it surgically removed. And you can actually send that bone off to a lab and find out what infections are in there. So the infections get in there, and they release certain endotoxins and biotoxins into the bloodstream, and that's a constant irritant to the adrenals and a constant irritant to you. So let me throw out a term that kind of all these things that we've talked about can cause. And we talked about cytokines. Well, cytokine-induced sickness behavior, or just sickness behavior. That's when your energy's low, you don't want to socialize. So you don't want to socialize, you're not interested in intercourse with your partner, you're not really interested in reading or learning, or you try to read and you can't comprehend. That's cytokine-induced sickness behavior. And so we always want to control cytokines. There's pro-inflammatory and anti-inflammatory cytokines. Most of the population have too many pro-inflammatory cytokines. And the jaw cavitations, the most accurate way to test for them, and there's only a few of these machines in the country, to my knowledge, it's called a Cavitat, Cavitat. And it's much more sensitive than an X-ray, and it picks up on those pockets of infection. And then I personally know of a naturopath who has the machine, and he goes around to different dentist offices, and he has before and after pictures of a certain photon machine that he has patients use, and it, along with taking certain minerals, will help eradicate the infection. The surgery, it's a short surgery, and you're only under mild sedation, but something about, and I think it probably has to do with the meridians of the body, jaw surgery can really, really, really knock you on your butt. And so you want to be very careful with that. You want to, if you do decide to have that, you want to make sure you have a very, very strong constitution. And one of the surgeons I know, he has people do IV vitamin C a few days before and a few days after, because it really is very stressful. I'd probably say it's more stressful than neurosurgery, just because I've been through jaw surgery. And dentistry hasn't really evolved very well, like the other medical professions. Some of the things they do are just kind of barbaric. They just kind of go in and hammer and chisel and do whatever. So those jaw cavitations, those are important because they've been connected to certain disorders and syndromes, but they can cause jaw pain. They may or may not cause jaw pain. They don't have to cause jaw pain. But they're important because they can release toxins into the body, and it can be just a constant stressor to your adrenals.
Wow, that's definitely something that's not addressed here locally.
Yeah, exactly. Well, the Cavitat machine that's accurate, that picks it up, is $28,000. So they usually don't want to buy it. But the naturopath that taught me about this photon machine, He has a Cavitot machine, and he goes to different dentist office, and he'll test for them, and tell them exactly where cavitations are. I got scammed out of a large sum of money being treated with ozone injections. So let me save you thousands of dollars and tell you, do not get ozone injections for cavitations. They do not work. My colleague, who's a dentist, a couple months ago went to a dental conference on ozone, and she said there was no mention of the use of ozone for jaw cavitations because it has a very short half-life. There you go. I just saved you about $20,000. If you've had your wisdom teeth removed and the ligament wasn't completely taken care of, that can cause issues. The other thing is if you have a malocclusion, meaning your teeth don't touch one another like they should, that can impinge on the trigeminal nerve that innervates the face. And the trigeminal nerve, if you're impinging on that, it puts you in a fight or flight mode. And so dentistry is, extremely important in that regard. And, there's a connection between cavitations and dental infections as well as certain heart conditions. That's why, you might have seen your dentist office a poster talking about heart disease and flossing and everything. I'm sure someone's probably wondering about oil pulling. I think it's good. I'm not as diligent about it as I need to be, but that can certainly help to pull out some of the toxins out of your body. If you've worked with me or read any of my stuff, you know that I perform gut tests and stool tests a lot. Well, there's actually a similar corresponding test you can do for your mouth to look at the different bacteria. But, the jaw and the teeth are something that I see people miss a lot. It doesn't mean you have poor oral hygiene. If you have a jaw cavitation, it doesn't mean anything like that. I don't want to get too off topic, but you can have low secretory IgA, one of your immunoglobulins, and that predisposes you to oral cavity infections, gut infections, lung infections, sinus and nasal cavity infections. So, don't forget to pay attention to your teeth. I recommend special toothpaste that's not in stores. It's called Livionics, Livionex. And I think you may need a code to purchase it. If you do, I'll look up my code. It's been a while since I've ordered some. But they're doing studies on it now, I think at UCLA, and it's a toothpaste designed to help break up biofilm. And I'll just give you a quick anecdote. One of my clients, she started using it, and she'd been using it for like 2 months or so, and she walks into her dentist office, and the dentist comes in, and he says, I don't know what you're doing, but you're doing something different. So it definitely has some pretty strong effects.
That is awesome. So Livionics, thanks for that resource. It can be difficult to find products that are free of harmful chemicals and that are actually effective.
Exactly. So we talked about mold, we talked about Lyme, we talked about some of the co-infections that go along with those things. We talked about mitochondrial dysfunction, which kind of underlies everything. We talked about viruses, and we talked about jaw cavitation.
Yeah, you covered so much. Thank you for going into such detail about these hidden causes behind chronic illness. But now let's open it up to our listeners. If you have a question about any of the topics Dr. Jackson addressed, please feel free to write it in the comments section. Our first question comes from Dr. Nicola Glenny. They want to know, can IgA be determined by your 23andMe test?
Your level of IgA, no. I mean, you can look at NTHFR support report. You can look at the IgA polymorphisms, which may hint at an issue with IgA. But again, just because you have the polymorphism doesn't mean it's expressing. So measuring it via stool test or saliva will help you determine your actual amount of secretory IgA. But the 23andMe just kind of tells you if you could potentially have problems with that.
Gotcha. So just because we have a particular SNP, that doesn't mean that it's expressing, so we would need to test IgA separately. On to our next question, another one from Rachel. It's regarding Lyme disease. She wants to know if you recommend a PICC line.
Well, if you're going to do antibiotics, especially long term, which is what most people do, I would say yes, because, constantly sticking your veins, they're going to get sclerosed, especially if they use a 3-day catheter. But you have to be extremely careful with the PICC line. You use hydrogen peroxide, several times a day. You have to flush it with heparin and saline to prevent clots. You just have to be extremely careful. PICC line is one option. The other option is a port they insert in your chest. It's a little less maintenance. You just have to worry about changing the dressing and things of that nature. But in general, I try to steer people away from using antibiotics so long that they need a PICC line.
Good to know. So while PICC lines are a viable option, if at all possible, you would rather treat Lyme without long-term use of antibiotics. And we have a follow-up question from Dr. Nicola, wanting to know if the DRG test is the best.
For stool tests, the two best tests are the DRG test and the Metametrics GI effects test. The DRG test hasn't yet added in a measurement for lactobacillus and bifidobacteria and a couple other things, but it's, about half the price or a little less than half the price than the Metametrics GI effects, but does use the PCR method. So the DNA probe method, meaning that it's going to be more accurate. Once Metametrics merged with Genova, they changed one of the pages on their test that was completely PCR, meaning they used the DNA probe, but they changed one page to a CDSA, a culture page. Not all the time, but many times I'll see the culture page, the measurements on there are kind of close to opposite the PCR page.
So do you recommend using both the DRG and the Metametrics, or does it just depend upon the patient?
I recommend usually people start with the DRG. If they can afford to pay for the Metametrics, then it's a good one. If they have someone that they see locally that'll order through the Easy Pay program, they can get the Metametrics test a little cheaper. Usually I recommend people start with the DRG test.
That's great info. Anything to save money is always appreciated. Looks like we have another question from Stephanie, or actually it's a comment. She says, just want to thank you very much, and she took copious notes.
Awesome. Well, thank you for listening.
Yes, thank you for listening. Hopefully this will be the first of many webinars. Another question from Rachel. She asked, do you treat H. pylori?
Yeah, I do. I have a fair number of clients that test positive for H. pylori. Depending on who you read, some people will say it's harmless. Other people will say it can lead to gastrointestinal cancer. I use a number of different remedies to go after it.
Great. Sounds like we could probably do a whole other webinar just on H. pylori treatment. Well, Dr. Jackson, I really appreciate you taking the time out of your schedule to present this webinar today, the first of many that will be featured on glutenfreelifestyles.org. It's great that you can consult with anyone worldwide, whether that be other practitioners or patients. So thank you again so much.
Great. Well, thank you guys for tuning in.
Dr. Jackson provided such a wealth of information. Now it's time for us to digest everything and see what we might be able to implement in our own lives. As promised, Dr. Jackson is offering our listeners a special. It's $150 off the total price of his Heal Your Body program. This includes one initial 1-hour consultation, as well as 4 45-minute follow-ups and 15 emailed questions. If you'd like more information on that, please visit Dr. Jackson's website at healyourbody.org. I want to thank you all again for listening. We are planning our next Gluten-Free Healthy Lifestyles Expo, May 13th, 2017. Please check us out at glutenfreelifestyles.org. You can also connect with us on Facebook, Instagram, and Twitter.